for inviting me, and thank you very much for attending very late in the afternoon. So I'll make my talk very brief. My colleagues talked a lot about perioperative management and how to prepare the patient for avoiding complications. I'll elaborate on some of the protocols that can help us in preparing the patient preoperatively. So why do you want to reduce the blood loss in spinal surgery? Because significant blood loss happens in spinal surgery associated with increased intraoperative and perioperative complications and costs, including bleeding, infection, nerve injury. And the most common one is of course, transfusion postoperatively. The incidence of major blood loss in adult spine fusion surgeries requiring transfusion in the literature varies between 16 to 80%. So one of the consequences, as Dr. Shimrani before elaborated on, is the transfusion postoperatively. And why is it a problem? Because transfusion usually may develop some reactions, increased incidence of surgical site infection, and then sepsis in sick patients, pulmonary embolism, a return to operating room for revisions, and disease transmission, of course. So preoperative considerations happen really early before the surgery, so we have to investigate for anemia and also platelet dysfunction because it's linked to a early or a high risk of early postoperative or 30-day morbidity and mortality. So underlying coagulopathies must be identified very early before preparing for the surgery, and efforts to reduce the incidence of major blood loss, often specifically focusing on platelet function, because patients who are taking antiplatelets or even renal patients who have platelet dysfunctions are the main focus for preoperative preparation. So the goal is to detect these patients as early as possible, as I said, and it will range from giving just regular supplements or even giving erythropoietin or autologous blood donation before the surgery. But what do the experts or the spine surgeons really think about this? So this paper shows a consensus for prevention of blood loss in spine surgery, and what they studied 25 surgeons around Canada who participated in this study. And they objected to identify patients at risk for increased perioperative blood loss and obtain expert opinion on how to minimize it, according to the surgeon's point of view. So we can find here that the total operative time of more than 5 hours was extremely relevant to those surgeons, and also the inability to discontinue anticoagulants and also antiplatelets due to any other comorbidities. But you find the preoperative hemoglobin, in their opinion, was not really relevant at all. And also they lined out that patients for deformity correction and also tumor patients were extremely high risk for postoperative bleeding. What preventive measures that they think that would be relevant is, of course, because they're surgeons, they thought that only intraoperative hemostasis was the most important or extremely relevant, and they found, or in their opinion, that preoperative autologous blood donation or even erythropoietin injection was not relevant at all. But we need to still study that in more details. How about benefiting from other protocols? The Seattle Spine team developed a protocol to prevent complication or avoiding complication perioperatively, and they divided it into early and late and intraoperative complications. So they developed a comprehensive standardized perioperative protocol, which is the system-focused Seattle Spine team protocol, an approach managing the adult lumbar scoliosis in patients centered on a live multidisciplinary preoperative complex spine conference and a collaborative intraoperative surgical team. So it means that there is a multidisciplinary team that looks at these patients, and they make these live conferences or boards similar to tumor boards, where they discuss the patient's condition, diagnosis, and they also have the expert spine surgeons in the department on board, and whether to decide what type of procedure and what indications that they have in order to eliminate surgeon misjudgment or error. and also application of rigorous intraoperative monitoring protocol to assess and treat blood loss and coagulopathy. And all these are centered for reducing the complication and improving patient safety and their outcomes. So who are the collaborative team members? There are anesthesiologists, orthopedic surgeon, neurosurgeons, neurologists, intensivists, and cardiologists, and of course internists. So the SSTP, they call for a live in-person multidisciplinary preoperative evaluation and discuss complex patient cases. These conferences are conducted on a monthly basis, like tumor boards, and involve representatives from many medical and allied health specialties. And they follow a certain risk mitigation protocol where they assess these risk factors and try to modify as much as they can. How about patient preparation and preoperative optimization? Of course, all surgical patients, in order to prepare them for surgery, they go through an extensive 2-hour education class, which is run by both nurses and one of the spine surgeons, in order to give the patients what do they expect to have intraoperatively and postoperatively, and also focusing on the postoperative recovery period, because when the patient knows what course they're going through, they will have a better experience postoperatively because they know what they are expecting. And all patients are then engaged in a lengthy informed consent process that includes discussion of risks and benefits. So this is their model here from preoperative medical evaluation, multidisciplinary conference review, and also reaching out to the discharge of the patients. So other relevant risk factors, including any procedure, of course, involving spinal osteotomy procedures, open versus minimally invasive, errors in prone position, and anesthesia experience. Of course, use of intraoperative cell saver, and my colleague, I'm sure he's going to talk about this, collaboration of 2 spine surgeons or 2 experts at the same procedure to minimize the operative time, aggressive fluid management, of course. And when we focus on reducing surgical time, proper planning is really paramount in preparing these patients, because you need the least time intraoperative to think about the procedure and the steps. So briefing your staff about the procedure and steps of surgery is really beneficial. Preparing appropriate instrumentation, hemostatic agents beforehand, and expert assistance to work on both from the anesthesia side and also the surgical side. So in conclusion, a strategy is to minimize blood loss in spine surgery is important. A variety of blood-sparing agents have been introduced and to accomplish this task. Patients should be preoperatively screened for anemias and corrected, especially for patients with platelet dysfunction. RCTs are needed for the use of new agents like TXA for optimal therapeutic dosing and timing and safety. We need standardized protocol for blood salvage regimens and studies assessing their safety, cost reduction in amount of blood products, and outcome. All concerned specialties, as you know, the SSS is a multidisciplinary society, so a multidisciplinary approach is always paramount and beneficial for the best outcome for the patient. Thank you very much.